Good evening and welcome. My name is Khalil Shariff with Aga Khan Foundation Canada and Aga Khan Foundation USA. It is a great delight to be welcoming all of you today for this special conversation on learning about learning in the Aga Khan Development Network. We're in the midst of a global pandemic that has affected all of us in different ways. And just as much as this is a health crisis, it's actually a crisis on many other dimensions. And one of those dimensions is that COVID has become a major educational crisis. As all of us know, one of the implications of COVID has been the disruption in our educational systems all around the world. Hundreds of millions of students have had their educations interrupted. Sometimes schools have been closed entirely, and in some countries in the world, those schools are still closed. Today, we're going to be having a conversation with some of our key educational leaders in the Aga Khan Development Network to learn about how it is that they are coping with the crisis and what we're doing to invest in the students and the teachers and the communities where we work to help them create the capacities to build back after this crisis and to become resilient through it. We're really excited to have Dr. Sweta Shah, who is AKF's Global Lead for Early Childhood Development, Nimet Rener, who is the Director of the Aga Khan Education Services and oversees the network of K-12 schools in Africa and Asia that come under the aegis of the Aga Khan Education Services, and Firoz Rasul, who is the President of the Aga Khan University. These three educational leaders will be sharing with us their insights and their wisdom and their encouragements about the kinds of things that they are doing and the kinds of ways we might be able to continue to support them. Now, tonight we have with us a very large number of people who have been supporters of AKF for many, many years. And I want you all to know how grateful we are for those many years of support. In fact, because of those years of support, the institutions which have been created in Africa and Asia have so many of the capabilities they need to respond to this crisis and to support the communities who we are designed to serve. And I think you'll see tonight how important those contributions have been over the years. Now, this conversation is part of our virtual campaign in both Canada and in the US. We have not been able to do our normal fundraising campaigns, which have been in person because of the current circumstances. But we have been delighted by the response as we've pivoted to a virtual platform for these conversations. I hope you'll all take some time to learn more about this virtual voyage we're taking around the world this fall. The chat box will have the links to the websites that you can get more information on in both Canada and in the US. So you can learn more about this virtual voyage. You can register to follow along with all the stops that we'll be making. You might be able to invite your friends and family to learn more about this. And maybe you'll even be ready to make a contribution to our important work during these difficult times in the world. Now I'd like to turn to these conversations with these AKDN educational leaders. I hope you'll enjoy learning from them, and we'll come back at the end and have a few more words as we conclude.
My colleagues and I have been working on many projects to ensure that hospital and healthcare providers, they have equipment they need to test and treat COVID-19 patients. There's a worldwide shortage for nasal swab for testing. So what we decided to print our own using our 3D printing lab. We have developed a nasal swab design with the help from Harvard University. So there's a massive shortage of ventilators in Pakistan, and in an emergency situation it may become necessary for us to use single ventilator on multiple patients at the same time. This is something that has only been done rarely in past, so we don't know how safe or effective that is. So we have printed this T connector using our 3D printers. This will allow us to use single ventilator on up to 7 patients. Currently, we are testing it in our simulated environment and also on our test runs to see how effective it is in terms of performance. We intend to share our findings with government as well as with other hospitals. So we are also working on developing a standalone, low-cost, basic ventilator. And most of those parts used in this ventilator have been printed in our 3D printing lab, as you can see here. Innovation is the key to addressing pandemic.
Well, as you've just seen, the Aga Khan University is playing a central role in the AKDN's COVID response, in innovating new approaches, in providing health services, and in educating across all their campuses. Today, joining us to talk a bit more about that is the president of the Aga Khan University, Firoz Rasul. Firoz, thanks very much for joining us today to talk a bit about Aga Khan University in the midst of this unusual global situation.
Thank you, Khalil, and thanks for the opportunity. This pandemic took all of us by surprise, and it was not something that many people who are alive today have ever seen a pandemic before. And to be able to react, respond in ways that would help the constituencies that we serve was something that we had to do very quickly. So as a university that runs hospitals, teaching hospitals, but also acute care hospitals, we're sort of in the middle of the action, if you like. And there are several things we're learning or have learned and are learning. One is that this disease, this virus, is unprecedented, and therefore nobody has ever seen this before. So there's so much that isn't known about it, and it affects different people in different ways, different ages, different parts of the world, and different ethnic groups, different occupations. So there is so much that we don't know, and that means there's so much that we are learning as this progresses. And that it means that we as a university should be studying, researching, trying to understand what this virus is, how we can treat it, but more importantly also what treatments, therapies, vaccines need to be developed to protect the people today, but also in the future, because as we have seen, this particular virus and this pandemic is coming in waves. So it's not like you will finish one and then you're done. There are subsequent waves. So what does that mean? It's also, some people are saying the virus is mutating. So it's changing. And so what does this changed state mean? So it's a time of great excitement in some ways scientifically, while it's also a time of great terror as people are concerned about their well-being, their family, their jobs, their economic livelihood, complete disruption to their lives. So it's a very critical time for the Aga Khan University to play its role in helping to understand, but also address the issues that this pandemic raises.
Feroz, there are a number of strands that I want to pull out and follow a little bit. In a sense, it's almost like it's exactly a crisis of this complexity that the university was, in a sense, established to be able to play a role in. Let's start with the healthcare service delivery dimension. When the university was founded in its initial phases as a health sciences institution, the idea of providing international standard healthcare was really at the core, a core principle of work quality healthcare, even in a difficult environment that the university was established in, and now I know providing care in a number of other settings. How has the pandemic created challenges for the way in which you're actually providing care, and how is it you're grappling with the requirements for continuing your commitment to quality despite all the difficulties of the pandemic?
So as you pointed out, the university was, from its very founding, its very inception, Hazrat Imam wanted it to be at an international standard, which means it had to work with peers across the globe who were at that high standard. And we had to first achieve the standard and then maintain the standard. Now, we are a private, not-for-profit university that runs hospitals. But we are a small part of a public health system. And we are in the developing world where the public health system is fragile, is inadequate in many ways, and unable to serve the populations where we are. So there is a role for us to play, but it's a role that has to be one of leverage rather than serving everybody, because we cannot treat all the COVID patients that come. But we have to figure out how do we assist, empower, and encourage in many ways the public system to take on the responsibility that it should. So in the first place, we had to figure out quickly how to treat these patients. And our relationships with international universities helped us understand, because the wave, the disease, COVID-19 came to Pakistan and Kenya and parts of the world where we are after North America and Europe, and of course after China. So we had some time to learn about what was going on, even though it wasn't a lot of time, it was weeks, maybe 3 or 4. And that allowed us to quickly reach out to our networks to understand what was going on, and then to be able to mobilize the resources that we needed. Secondly, knowing we can't treat everybody, we needed to understand how we can work with the government in first making public policy about movement of people, about shutting down schools, about public transportation, and so on the one hand, and on the other hand, providing advice and support on how to treat patients. And in particular, the biggest dearth in the developing world is in critical care beds. These are intensive care unit, ICU beds. And as you've heard, COVID patients can deteriorate extremely quickly. And particularly if they have what are called comorbidities or other ailments that accelerate this deterioration. And so the ability to, or the capacity to have ICU beds, equipment, nurses, doctors is critical for any country. And in Pakistan, for example, or Kenya, they don't have, the public system doesn't have enough. So what we did is we created this tele-ICU systems. So any doctor in any part of Pakistan was connected to us. And this was done through the support of the Gates Foundation, who was very excited with this initiative that we had come up with. And they were prepared to fund it. So we created this tele-ICU link that across Pakistan was able to respond to a doctor in a remote area where the patient that was critical, and they didn't know what to do because they were not an intensivist who's trained to do this. So our intensivist helped. And as the numbers got bigger of patients that needed help, we actually went through our alumni in the US who also agreed, whatever time of day or night, to be connected to a doctor to provide this assistance. That was the vision that Hazrat Imam had, which was that AKU should be able not just to deliver, but also to empower and facilitate expansion of this type of quality that we were expected to provide. And as our partners saw what we were doing, they were very excited, and many of them offered to help. So we were able to take AKU's core facilities or core capabilities and expand it to meet this vision to be able to serve the countries where we were.
Firoz, what an incredible set of initiatives. Let me turn to another strand in your initial comments, which is around research. I mean, another principle of the founding of the Aga Khan University was that we really should be at the frontier of knowledge, that we should be a research-intensive university, especially looking at the issues and challenges of the developing world, because there wasn't a lot of dedicated knowledge capacity looking at those issues. Now, it seems to me, for all the reasons you've already mentioned, that COVID has presented all kinds of very important and quite interesting scientific questions. How has AKU responded with its research capacity at looking at some of the frontier questions that COVID is presenting, and what's its link back to the actual quality of care and the quality of life of the communities that the university serves?
So this is one of the most exciting parts of what we're doing with and about COVID. As you pointed out, Hazimam set up AKU to be a research-led university, research-driven. And because research means you are creating, advancing new knowledge. And one of the things that we realized very quickly is that the COVID crisis is a level playing field. There is no part of the world that knows more about this than another part of the world. So there's an equal opportunity, if you like, no matter where you are in the world, to be able to uncover or discover something about the disease as much as anywhere else. And so very quickly, we started to look at a number of factors that were mysterious or mystifying. One is, why did Pakistan and Kenya, the countries that we are in, have relatively few deaths from COVID compared to countries in Europe, countries in the US, in Canada, and so on? That it's still not clear. And we are at the middle of this, trying to understand what is it about our populations, about our environment, about our diet, about whatever way of living that is contributing to this. Is this short term? Does this have a particular benefit that we could unlock and understand how this might help others? So that's a particularly interesting set of questions that we are dealing with. Also, because we are in a low resource setting in the developing world, we have had to make do with innovations, or we have had to come up with innovations to be able to extend our PPEs, the protective personal equipment. We have found a way to disinfect masks so we can reuse them. We have found a way to develop our own nasal swabs because you couldn't import them. Nobody wanted to part with them. And every country wanted to keep all the supplies they had. So we had to print our own. So we developed 3D printing. And so we developed those swabs. We had to come up with ways of being able to use a ventilator on more than one patient because we didn't have enough. So we had to be able to come up with those types of questions. We have apps that we've created for the population so they can monitor their own health and they know where they can get advice and there's information available to them. And we've also developed apps for our employees and students. So before they come to work or they come to the university, they do a self-check and we know what their state is. And then we direct them accordingly. Either they can stay at home or they go for a test or they can come to class or to work. So these were some of the initial areas. But what is now the new phase that we're getting into is that we have been selected because of the quality of our facilities and our people to be clinical trial sites for vaccines. And there are two vaccines that we are testing right now. One is a vaccine called CanSino, which is from China, which is being tested in Karachi, and what they call phase 3 trials, which is the final stage before approvals. And in Kenya, we are testing or trialing a vaccine from Sanofi. And both of these entities have selected us because they know that the quality of data, the quality of testing that we will do will contribute to their global understanding of how this vaccine works in different communities, in different parts of the world, in different age groups, in different ethnicities. And all of this information will be then combined for their application to go to commercial production and for use with the public. So we're playing very critical roles in the countries where we are for the populations that we serve to be able to test these vaccines so that they can be ready for use immediately that they get approved. There are other research areas that we're involved in that relate to new therapeutics, new drugs that are coming out. In testing them we've done a couple of the remdesivir, which is a drug that is being used widely, has been tested by us to validate it for our populations. So these are some of the very exciting new areas that we are working on. and creating a new understanding that we're sharing with others.
Firoz, if that wasn't a sufficiently staggering agenda for the university, you're also, of course, providing education to cohorts of students in the health sciences and other areas. Obviously, COVID has challenged educational providers around the world. Educational institutions have been shut down. They've had to pivot in different kinds of ways. Talk to us a little bit about how AKU is adapting itself to the challenge of providing education also at high quality and in a pretty sophisticated areas to its students, despite all the challenges that COVID is now presenting us.
Well, education institutions have been affected in a big way. And in particular, we have to follow local regulations. So governments dictate or decide whether schools are open or closed, or whether universities will allow in-person teaching or not. So where we have non-health sciences students, we're basically doing only online learning and teaching. And we have developed this. We have a really great group of our teaching and learning network that trains our faculty in not only how you deliver online courses, but how do you design these courses? How do you design teaching materials? How do you assess whether the students are really following and are actually able to deal with the material in this way? Because this is not something they're accustomed to. What about students who don't have internet? What about students who don't have electricity? Because in our parts of the world, these are things that happen, because these are not stable services that are available. So that's one set of students. But then we have students who need clinical hands-on training. They need to be able to learn how to treat a patient, how to do an operation, how to fix a broken leg, how to deliver a baby. You can't do this online. And this has to be done in a hospital or in a proper setting. And this is where we have been working with the regulators, but also our own students and parents who are also worried. So we have created cocoons, if you like, bubbles, where our students come in, they stay on campus, their housing is on campus, their classes are on campus, and their movement is very carefully monitored and controlled. And the students understand these constraints under which we are trying to do this, and they've been extremely cooperative and extremely willing to be able to put up with some of these inconveniences. We've had to cordon off parts of our campus not to allow the public, because in Karachi, for example, our nursing school and medical college is smack in the middle of a hospital campus. So we've had to cordon off a number of spaces to restrict movement of people. And we've also had to work with our students there's been a restriction on their social interaction because as everybody understands, not only do they have to wear masks and continually wash their hands or sanitize their hands, but also their ability to work in close quarters is restricted. So we have had to adjust. Until now, we haven't had any outbreaks or had to close classes. We test our students every week. We have a hospital, we have a testing service, very reliable. We do a lot of tests for the public, so we can certainly test all of our students and the faculty that teaches them. And we continue to monitor this. But as the cases are increasing, as the positivity rate, as they say in the test, the number of people testing positive in the population that we are testing, as that starts to increase, we're going to have to continue to review and perhaps to adjust how we are working with students on campus. But so far, I think when people even from other institutions come and see what we're doing, they're impressed. They want to learn from us, even from outside Pakistan or Kenya, and about how we're going about this. And so far, we've been able to keep it going, and the parents and the students are happy.
Firoz, maybe we just step back as we conclude this fascinating conversation. In a way, as I'm hearing you speak, it seems like COVID is exactly the kind of multidimensional crisis for which the university was established to be able to respond. I mean, it's there was. I mean, yet again, I feel like we're experiencing, as the university contends with the response to COVID, the prescience of establishing in the developing world world class knowledge institution. Now it's taken decades of support from obviously from the chancellor, from many leaders, and from many donors and supporters from around the world, including many of those who we might be speaking with tonight. But can you just step back and reflect a little bit that it does seem like this is exactly the kind of challenge that requires all the capabilities that a high class, a world kind of class standard knowledge institution like a university would be designed to address.
Among the founding principles that were set out by the chancellor was that AKU should be able to serve the populations in which it is based in enduring ways. So it's not a short term, it's a long term commitment to serving, helping communities within which we exist. And that role can only be meaningful if the impact we are making is one that solves problems that these communities have or are dealing with. And in order to solve these problems, if we can bring to bear both local knowledge and best practice that we have heard many times being mentioned, then we are doing a great service to these populations. But to be able to build these types of capabilities, to bring international best practice, we have to be able to bring on board people, technology, facilities, and so on that are equal to anywhere else in the world. Otherwise, how do we attract the best people? How do we keep the best people who are born in these countries? Unless we can provide them a working environment where they have peers that they're excited about, that they can learn with, learn from, that there's facilities that they are excited about coming to work every day, and that there is equipment available to them that allows them to do their research, for example. And none of this would have been possible without the commitment of our donors. Our chancellor and founder established the university, but what is keeping us now at the forefront of these areas that I described is the generosity and support and commitment of our donors. And I hope that they've already seen the areas that we are into. I mean, everything that they hear about, no matter where they are in the world, big data or data analytics, artificial intelligence, stem cell research, neurosciences, the microbiome, all of these are areas where we are at the forefront of all of these, just as other institutions. And there are people who would like to work with us because we have knowledge now that we are creating. And I'll give one example. And a problem in our part of the world that is currently very acute is stunting in children. These are children at age 5 are stunted. In Pakistan, the statistics are horrendous. Almost half the students are stunted. Half the children by age 5 are stunted because of malnourishment, because of early childhood, the lack of early childhood care and development, and proper drinking water, and maybe they're a child of somebody who was stunted before, in the previous generation, their mother or their father. So how do we deal with this situation? Because if a child is stunted, they are disabled from learning, from growing, from really realizing their full potential in life. And this is an area where AKU is spending a lot of time in understanding not just the reasons of public health in what causes this, but what about the biology of the child, of the body, that may be contributing to this condition. And in this regard, we are working with Harvard University and University of Virginia, who are interested in studying our populations, because they don't see some of this in other parts of the world, although stunting is a scourge of the developing world. But it is something that we have a particular expertise in, that we have developed, working with mothers and children. And this is now enabling us to work on the frontiers of science that helps us create knowledge, not just for our populations, but also for other populations in other parts of the world.
Firoz, it's been an extraordinary experience hearing everything that the university is doing during these difficult times, not only to respond to the crisis, but to think again well past the crisis into the future, looking at issues at the frontier and building the next generation of leaders in health sciences and elsewhere. So look, Firoz, please know that you have lots of supporters. Please convey our best wishes to the entire team at AKU during these difficult times. And you have our gratitude and our admiration for the extraordinary work that's being done on this issue and on so many others. Thank you for joining us today.
Thank you for inviting me.
And joining us now is Nimet Rener, the director of the Aga Khan Education Services. Nimet, thank you for joining us. We've had so many questions from our supporters about how AKES and the school system are responding to this crisis. So we're really delighted you've been able to make some time in the midst of all your heavy responsibilities to speak to us for a few minutes. So thanks very much.
It's a pleasure, Khalil, and thank you for inviting AKES and me onto your show.
Nimet, quite a few of our supporters have written in to ask, how has the pandemic affected students under the AKES umbrella, and what measures has AKES been taking to support students during this disruptive time? You can imagine that this is one of those things that every family in the world in some ways is managing. So there's a lot of empathy, I think, from our supporters in North America about the condition that must be confronted by families that AKES is trying to support. Can you tell us a little bit about what the issues now are and how AKES has been able to adjust to the circumstances?
Definitely, Khalil. I mean, as you quite rightly pointed out, this is a global phenomena, and every family, I think, globally has been affected by this pandemic. As a school system that spans over 12 countries, very, very diverse, there's been a fundamental impact, which was the closure of the schools. And for students and teachers, not being able to meet face to face is pretty profound in a way, because this has been the context in which most of learning and teaching and engagement has happened. But the closure of the schools, apart from the fact that children were not able to meet with their peers, they stopped having the kind of routines that they were used to, the extracurricular activities that they were not having. But we know how much children actually need the contact with their peers. And especially our secondary school children, our teenagers and older students have really, really missed and needed that engagement. But the younger ones have actually missed their teachers a lot, is the feedback that we've been getting, is that regularity and that relationship seem to have been something that they have missed a lot. In terms of responding, I mean, as you know, it happened very, very suddenly and pretty much overnight. And as an organization, our response was to act quickly to ensure that learning was going to happen no matter what. And we were so moved by the impetus from our teachers from very remote areas where there was no connectivity or access to their students, down to our urban settings, where we galvanized very quickly online. And this wasn't online learning as is in a regular school where it's an integral part of the curriculum, but this was emergency remote learning. And I wanted to underscore that differential, that we had to go into emergency remote learning. And I'll give you very few headlines, Khalil, and we're at the sort of early stages of amazing innovation coming through in very difficult contexts. The online, where we've had Google Classroom or Microsoft, and parents had connectivity at home, that was a pretty standard ramping up of how we were shifting from an integrated process in school, which was face-to-face as well as digital learning, to full-time, where teachers were actually teaching and engaging. But then we had to look at places where there was no connectivity or minimal connectivity. And that's where the innovation was quite significant, where, for example, in northern Pakistan, recognizing that many of the households had access to cable, but nothing else, is that we mobilized the cable television and started to run courses from there. And the wonderful offshoot of that was families learning together as they all started to attend. We've had parents come and be given USB keys that had loaded lesson plans and activities. We had in Afghanistan SIM cards given to all our teachers and the families so that they could speak to each other over the phone regularly. Packs were made for those who had no connectivity whatsoever, and we've had staff walking miles to get these packs to families. But all this interaction has meant that we were also able to communicate health messages around COVID, because there was very little avenue for that. Now, Khalil, the challenge is, though, while there's, those were the regular things that most people have reacted globally, I think, around the responses, has been the impact on families as a whole. And I think that we recognized very quickly that we had to turn up the volume on our social and emotional attention. And our priority as a system was first and foremost about the well-being of the adults in the system, because we recognized that if the adults who were so shaken by this whole event that seemed initially an event that was going to go away in a few months, we just needed to knuckle under and ride it, which has now become something that's here and fundamentally changing the way we are, was really paying attention as leadership on the emotional well-being of staff and recognizing that they themselves, although they were teachers now reaching out to their students from home, were also dealing with the same issues in their own home with their children and needing to be parents supporting their children. So there's been a shift in terms of the relationship with families very, very significantly, in terms of our own teachers learning to be counselors at some stages or starting with asking how they're doing. We worry sometimes about the stress that's caused families who have had to be challenged economically as well. So there has been the focus on families who are infected, but also affected, because as extended families started to get affected either economically or even for health reasons, it's been a very unusual time in terms of what we've had to take decisions around. And it came to how do we deal with what's most important about education, which was what does it mean to be human, actually. And what really matters at the end of the day was getting through a shared experience that was affecting all of us fundamentally, but in different ways. So there's been a shift in that, Khalil, and we are extremely worried about the equity gap in learning, and it's exacerbated, I think, in a way where the inequities are, and that's a piece that I imagine you want to know more about.
Well, I was going to say, Nimet, thank you for that kind of laying out the landscape. In fact, that the issue of the inequities in the global system, and of course in any particular country where we work, is something that I think is on the minds of a lot of people, including our supporters. Imran Khan in Toronto asked a question really about what we would call the digital divide. The idea is that online learning requires online access, and you've talked a bit about this. But I mean, obviously, we work in a lot of places where that access is massively limited, or maybe not available at all. And Imran is kind of reflecting: well, are we worried that this is just going to exacerbate all kinds of inequities and marginalizations in our countries, in our system, in the world? I mean, how should we think that through? Could this be a period when we see a massive exacerbation of these inequities and marginalizations?
I think the inequities have always existed. It's just that it's shed light on them. But I think it's also an opportunity for us to radically rethink education. And, what we've learned just through these 9 months is that learning can happen in all shapes and forms. And when you start to put some of that learning into students' own hands, actually, sometimes there is a significant engagement with their learning. And that as we look at the software that's coming out around adaptive technologies, where students, it's the feedback's coming through their own engagement with the software or the programs, they are flying because they're not being held back. And it's showing up where there is a bit of struggle for a student, so we can address what's going on. So I think that while absolutely the inequities are there, and the issue of access and physical access to connectivity, bandwidth, devices, even English language, without having English language, there is a real disadvantage because most of knowledge on the web is in English. But if I set that aside for a moment and say, well, what's the opportunity? Well, the opportunity now is to really radically, boldly ask ourselves, well, how is learning going to happen? And what learning needs to be supported? So learning how to learn has been a long statement that's been around about 21st century skills and lifelong learning, and students need to learn how to learn. Well, certainly that's what we've had to be doing over this 9 months, is helping students figure out how to, in a way, begin to manage their own learning, because there isn't a class always managing it. And so there's going to be work around that. The other is what's going to be the shape of schools. Now, right now, with the return to schools in some of our countries, the regulations, understandably, around safety means we can only have half the number of children in the buildings at the same time. So the question is, what role do buildings take now? And why would we come face to face? So how do you leverage the wonderful opportunity of being together face to face? And what can actually be put in the children's hands to get on with? And how do we rethink this? And it's a potentially exciting time, but a school system like AKES can't do it by ourselves. We need enabling environments, governments ensuring infrastructure, software being culturally appropriate, relevant to contexts, curriculum being rethought in terms of what's really essential, because content fact-based curricula gets redundant very quickly, as we know, and that's obtainable now, readily obtainable. So what do we focus on? The role of teachers now. The role of teachers has changed a bit over our 9 months as facilitators, enablers of how children were learning. Much more of a pastoral care role has been highlighted.
Well, Nimet, this issue of the changes in the fundamental model of schooling and the way we think about the schooling process is a question that's on Ramzan Amiri's mind. He's written in from Anaheim, and he was asking about the curriculum, and he's asked, should schools change curriculum to meet the challenges of online learning? What are the, I guess, upsides and downsides of moving to a more online basis? You've talked about the engagement potentially of the right kind of software, but also the limitations in terms of software that's culturally appropriate, that's in local languages. How does curriculum need to change in this online world?
In a way, Khalil, I would de-link online and curriculum. And I'll tell you why I'm framing it that way, is that the issue of online it's an enabler for learning and access to learning. However, there is curriculum content or skills related to the issues of digital learning, computational skills, the whole digital literacy. But the curriculum itself is, again, what I was saying earlier, is what are the skills and aptitudes and values that we require for thriving in the future that's round our corner. And we know the research that says it's actually the soft skills, it's the emotional intelligence, it's the ability to work in a team, it's to be agile, it's to be nimble. Now, so there's a lot of thinking to be done. And because you know that I have a particular affinity for early childhood development, I mean, this pandemic has been the hardest on the little ones, because social distancing for 3-year-olds, 4-year-olds, 2-year-olds. So, and the solutions of online have not necessarily been the most, accommodating for young children, and neither should it be. And so the focus on supporting families in understanding their children's development needs and really beginning to support families around that has also been key. So I'm not wanting to evade the question around curriculum and online. I'm just saying that digital availability and the whole virtual learning is a fantastic asset to catalyze, allow for more personalized learning, to create more equity in terms of access to best practice and, high quality information and experiences. It's a bridge, it's an equity, but of course the basic training of teachers, students on digital literacy would need to become part of the curriculum as a non-negotiable if we were going to make that available.
Nimet, one of the striking things about the AKES school system is how diverse it is. You know, there is everything from a IB caliber high school in the middle of bustling Nairobi to a one-room school somewhere in a remote valley of northern Pakistan. What have you learned about the diversity of the system during this period and how that has affected the way in which COVID and the response has had to play out?
Mm. Well, the diversity we've always known. But actually, what we've learned is the strength of our DNA.
Mm.
And what I mean by that is that because we were not physically traveling to visit and meet each other, the coming together was so frequent from all different corners of the world. Regularly, every week now, there were global meetings of heads of education, groups of math teachers, globally. That what we've learned is, and the metaphor I've given in the past has been that while the diversity is what we love and value and want to honor, is they're like these beautiful beads of a necklace. But what's got strengthened is the string that binds it. And what has been the same is teachers need care and I would say when we're now using our digital tools and means to reach our students, we're actually entering someone's home. So enter with respect, enter with care. Now, that doesn't matter whether it's the home up in the valley or in Nairobi or in South Pakistan. We are entering people's homes and we do so with respect. What we've learned is everywhere there is still issues of safeguarding, there's an underbelly to this and a concerning aspect to this, which also goes back to how we support resilience and people's ability to deal with stress, family dynamics, which we as educators don't get into per se, but the relationships we form with families can at least help in terms of support and enabling. So, but it's also thrown up inequities, Khalil, but it's also shown us, for example, we had a sweet example of, because our South Pakistan schools had access to Google Classrooms and Microsoft and connectivity, the minute we were able to increase bandwidth in some of our northern schools, strong teachers from the South were teaching students from the North, and some strong teachers from the North were teaching students in the South. Now, what we're going to see is that while we have diversity, there is actually a bridging happening and a coming together. And actually, our problem isn't that different from yours, but look, this is how we solved it. Or you have something amazing that we want to learn from. This has actually allowed bridges over this diversity and a desire to close some of the inequities really from the heart now. It's no longer an observation, oh, we have diversity, but it's being felt now and a desire to what do we do together to start closing some of the inequity gaps. So these have been some of the the DNA of AKES, and I'd say AKDN, have really, really come into their own. It surfaced when it needed to surface, and it's been very palpable, Khalil.
Nimet, you have, with great insight and thoughtfulness, really helped us understand both the opportunities and the challenges I think that we are grappling with as this unusual situation of COVID continues to confront us. Please know that there are many supporters around the world who are thinking about you and all the teachers and students and other leaders in the system, and really are hoping and praying that all your important work continues to meet with success during these difficult circumstances. Thank you so much for taking the time out to speak with us today.
No, thank you, Khalil. And I want to just again really acknowledge all the teachers and their families, because the partnership that's now unfolded between families and our teachers has been important. But they're the heroes out there.
Agreed, Nimet. Thank you. All the best.
Thank you very much.
But we sometimes give too little attention to the schools which prepare young children for life itself, in all of its holistic dimensions. And yet the evidence accumulates steadily, showing that an investment made in the earliest preschool years can bring enormous dividends as a child proceeds from one level of education to another.
Joining us today to discuss the very formative years that His Highness the Aga Khan was just talking about is Dr. Sweta Shah, AKF's Global Lead for Early Childhood Development. Sweta, thanks so much for making the time to join us and for talking to our supporters today.
Yeah, thanks so much, Khalil. I'm thrilled to be here.
Sweta, can you start by telling us a little bit about your role at AKF?
Sure. So I provide technical and strategic leadership to the organization. That goes everything from technical support to country programs, all the way to coordinating with other AKDN agencies and building partnerships with external partners, including donors.
Sweta, we've been talking a lot about COVID, and we've been saying that COVID looks like a health crisis, but actually once you penetrate beyond the first impressions, you realize that it's actually a crisis along so many other dimensions as well. COVID has clearly had a very significant impact on children, even if they're not being infected with the virus. What are some of the big challenges that you're seeing faced by children as a result of COVID? What are some of the barriers? One of our donors, Nuhat Pirani, was asking specifically about some of the barriers now that our young children are facing as they think about at least their educations.
Yeah, so Khalil, this is something we're very concerned about. You're absolutely right. This is not just a health crisis, but we're really concerned because many schools around the world are closed. Many are virtual. When you think about young children, virtual is not really the best in terms of best practice for learning for young children. Our approach at the Aga Khan Foundation and within the Aga Khan Development Network is very much interactive, play-based learning. And so the fact that schools are closed or they're virtual in some places is really concerning to us. We are seeing, though, that we are able to, through this crisis, see real innovations. We know that a number of countries are probably going to have a full year where children won't have access to any sort of education, whether it's virtual or not. And this is extremely concerning to us. So we've taken a number of steps to really address this and to support governments, and in particular to support our communities. One of the things that we've done, innovations, and I'll just share an experience from our program in Kenya, is that we've partnered with Nation Media, and we've actually started a nationwide television program for children, targeting children and their parents. So this is, of course, looking at small children, but it's relevant for older children as well. And these short little shows are storytelling. And so it's fun for families. They can sit around TV and watch someone model what storytelling is about. And so it could be reading a book or telling a story. And what we're hoping to do from that is help parents who are really now in the driver's seat in terms of children's education in many of our countries, to really see what is good storytelling, what is a good conversation, how can you promote literacy, vocabulary development, analysis, critical thinking, some of the really important 21st century skills that are in our program. So that's one example. Some other things that we're doing is using radio. Many of our contexts don't have radio, don't have television. So we try radio. We are also using SMS, WhatsApp, and a bunch of different modalities. But to give you an example of what we're doing with radio, our affiliate organization, the Madrasa Early Childhood Program in Tanzania, is working on, again, short little radio programs that focus on literacy and numeracy skills. And again, these are like usually 10 to 15 minute spots. So it keeps people's attention, but it allows for children and families to get some input. We've done some surveys in Tanzania to look at the impact of this. And we've been really excited to hear that parents are actually engaging with their children more. They're having more conversations, and some of the activities that they hear about on radio, they're actually continuing to practice with their kids at home. So these are all very encouraging types of innovations that I feel that we've made to support this crisis.
Wow, that's very, very exciting to hear, Sweta. It's kind of strikes me as I hear you talk that the educational barriers are one part of this, but the crisis has been disorienting in all kinds of ways for all of us. Presumably,
Yeah.
the psychosocial impacts of all this for children must also be pretty severe. Is that something you're seeing, and are there things that we can do to support that part of the childhood experience as well?
Absolutely. And that's been actually one of the things that we see most. In my experience in working in humanitarian contexts, the stress and psychosocial aspects are really, really difficult, and sometimes even more difficult to manage than access to learning opportunities. So that is an area that we've really, really targeted in our COVID-19 response as the whole Aga Khan Development Network. And I'm pleased to say that, we're forming new partnerships. So in northern Pakistan, we have a new partnership with UNICEF specifically tackling issues of mental health and psychosocial support. We produce guides and practical tips and tools to help families and children to use really fun play activities to promote psychosocial support, to help families and children release stress. And when they do that, that's going to really change their whole approach, and they're actually going to be able to learn better as well. So psychosocial and stress management has been a big area. And I would say, Khalil, not only for our communities, but for ourselves as staff as well. So it's been a big emphasis with AKF also overall for our staff as well, because we're kind of going through the same thing that many of our communities are going through.
Well, I mean, it's one thing that, in a sense, binds the whole world along during COVID. I mean, in a sense, it's been such a disruption for all of us. It's one of those areas where we can somehow feel our interdependence, maybe more viscerally than we have in a long, long time, because it's such a global and universal crisis. And of course, that's going to be the same for the kind of children around the world. Where all of us are confronting our children at home, also maybe dislocated, not being able to go to school, not being able to see peers and friends and relations as they used to before. So, are you worried about the longer term consequences of all of this? I mean, what does this all suggest for our longer term programming in early childhood, which we know His Highness has emphasized as such a strategic priority for us? Do you think COVID is going to change our long term posture?
So I think actually COVID has changed a lot and is going to change a lot. And I would say obviously there are a lot of negative impacts, which is, children losing all this time in school, using opportunities. But I think there's some silver linings to this as well, that I've been really reflecting on. One is all these innovations that we're now making, use of TV, use of radio, use of WhatsApp, use of SMS. Those are things that we're going to continue utilizing as we move forward, because in some of our most remote geographies, the issue of access is still going to be there. The issue of having teachers who don't have sufficient training and background is still going to be there. So we need to think about innovative approaches to reaching our most rural communities. So some of those actions that we've started, we came about it because of COVID. We had to be creative, but those are things that we are going to want to keep to some degree as well, even when schools open. So I think that there's a lot. And then the other thing that we've seen is as an ECD community, we know and we promote parents as really the first and most important teachers for their children. And for so long, we've been, trying to promote more active engagement of parents. And now parents are thrown into it, and they're realizing that actually, education system does a lot, but we need to step up as well. And we're seeing all over in all of our contexts, and probably in Canada and in the US where I am, including you and me, we have to step up. There's no choice. And so I think another silver lining actually is the amount of the amount that parents are learning through this process about their own role and just empowering them to really be in the driver's seat with their children's education.
Oh, that's a really thoughtful and insightful point, Sweta, because in a sense, uh, I think a lot of parents, I mean, I know we felt this, have all felt kind of inadequate in relation to the new responsibilities we've had for our children when schools have been disrupted and sometimes closed. Do you think we're doing enough to support parents? What can we do? What have we learned about what it takes to support parents to be really caring but effective caregivers for their children, especially at a time like this?
Well, I think the first and most important thing, and this is our approach, whether, even before COVID, but I think it's kind of deepened and strengthened, is that we need to start with where parents are. So parents, they don't know nothing. They know a lot, actually, right? They come with a lot of assets. They have the best intentions for their children. So what we are here to do is to support them, to empower them, to help them see actually that a lot of the things they do in their daily lives are really critical for children. So for example, when I mentioned storytelling, I mean, that's something that any parent can do, and probably many do, is you can even talk about your own life. And that is learning as well for children because they're learning content, they're learning vocabulary, they're when you do storytelling, they're learning about how stories are written. So I think we need to start with where parents are. I think parents do, though, need more peer-to-peer support because parents are also struggling with the stress and the psychosocial challenges. And so we are trying to have more peer-to-peer conversations. Sometimes parents just need to, express the challenges that they're facing with their kids or the stress they're feeling. Sometimes parents want to talk about something else and get their minds off of coronavirus. And so we are doing a lot to bring parents together to facilitate discussions around children's learning, but also sometimes just for them to talk to other people. Because of coronavirus, we are all isolated. Many of us, in many contexts, we all have to social distance. We are not able to socialize with other people in the same way. And as humans, we are social beings and we need that. So parents and supporting parents has been critical to our work. And I would say with this virus, it's even deepened within AKF.
Sweta, you've been at this for a long time. Any surprises for you as you've gone through and watched the way in which either children or the communities where we're working have responded to the crisis in relation to caring for and helping the development of their children?
Yeah, so it's been amazing, actually. I've worked in so many humanitarian contexts as well. And it's interesting that when we...
By humanitarian, you mean like real crisis situations?
Yes, absolutely. So war, refugee contexts. And, what's interesting is that we have in some of our geographies, such as Syria and Afghanistan and northern Uganda, they're in chronic crises as well. And what's been interesting is as we've been working with all of our country programs on changing their modalities for teaching and learning and thinking about different approaches, we found our teams and our communities in these areas to be extremely resilient and flexible. And actually, they've been able to adjust to these changes faster than some of our other country teams who are not, they have more stability. So that's been really, I guess when I heard about it, I wasn't shocked by it, but I didn't realize it until I heard it really from the teams. So just remembering that resilience and what you bring with you is, helps you build that resilience. I've also been really happily surprised. I go back to parents and been thrilled and really happily surprised by how we're seeing families really rise up and really take the lead in their children's education and working with school systems to make sure teachers are, that they're providing the best support to teachers and to education staff. Now, we're not expecting parents to be teachers. They are not. Teachers are specialized. They, are professionals, but there's a lot that parents can do to support teachers to enable better learning. And I've been really happily surprised to see how we're seeing families and parents really rise up during this time.
Sweta, earlier we talked about how COVID has got these universal characteristics. In a sense, we've all been confronted in some way or another by needing to think about children at home. You've seen a lot of crisis situations. What's your advice to all the parents out there as they try to contend with what might continue to be months of disruption still in their children's regular routines and schooling?
Yeah, so I think I go back to some of the basics, which is routine and stress management. I think when families are able to have a routine, which it would surprise you, but it can be hard to do when, especially if children are home all the time and you're trying to work. I mean, we have very different contexts, whether you're in Canada or whether you're in Afghanistan, of course. But we know that there's a huge burden on parents and families right now. And so I would say create a routine, whatever that routine is. Try your best to keep to that routine. I myself have created multiple routines for my family and have not always kept to them. So it's always a work in progress, and don't beat yourself up if like you can't perfectly fit your routine. But routines do help in making not only families but children feel a sense of stability and calm. And then the other is really critical for parents themselves, is take time out for yourself, for your own mental health and for your own physical health. So, many parents and adults are juggling so much right now, whether maybe they lost their job and they're trying to figure out how to get a new job and earn living, or whether they're working full time and have children at home. But looking after yourself and your physical and your mental health is critical, because if you, as a parent and as an adult in the child's life, are able to be calm and stable, that is going to help that child as well. And children really pick up on parents' emotions and what parents are feeling, even if they don't say it. So keeping ourselves as calm as we can be. There are times when, like, I also, struggle to keep it together. And then I just have to take a breath, away from my kids, take a little breather, maybe take a walk if I can, read a book, and then come back. And then I know I'll be a better parent. So I think self-care is really critical. And I would say try your best to keep to routines.
Sweta, that's advice we could all use. Thank you for those nuggets of wisdom. Thank you for all that you are doing. We know from all the research how important the first few years of life are for the entire lifespan. And so thank you for all you're contributing to help AKF serve these communities who are confronting so many difficulties. And if we can continue to safeguard the life and the environment of the children, even amidst this crisis, hopefully we'll be able to prevent the lifelong consequences being too severe, and maybe even, as you say, find some silver linings that will allow these children to flourish in the years ahead.
Yeah, thanks so much, Khalil.
Well, let me reiterate my gratitude to Sweta, to Nimet, to Firoz for sharing their insights with us and helping us understand how it is that the various agencies of the Aga Khan Development Network are responding to the crisis, but also looking to the future and looking at some of the important priorities we will need to address to continue our effort to improve the quality of life of some of the most marginalized communities in the world. Of course, what they have talked about in education is just one element of the response, which is a broad-ranging response that deals with healthcare, of course, with deals with livelihoods, with deals with so many of the gender dimensions of this crisis. There is a lot of work to be done. And so I'm delighted that we're being able to have this conversation as part of our fall campaign, this virtual voyage around the world that is replacing the usual fundraising campaigns that we run in Canada and in the United States. So I'm delighted so many people have come forward to register, to reach out to friends and family, and to make a contribution. And I hope tonight's conversation will inspire you as well. So please do go to the websites in the chat and in the links below, both in Canada and in the US, to learn more. We are going to be traveling to many of the countries virtually where we do this work, so you can meet the communities and the people who we've been investing in and whose lives we've been seeking to support. That work is ongoing, and the needs have never been as profound, frankly, as we're finding them today. So we do need your support. I know we can count on it. Thank you for all the contributions you've made so far, and I look forward to you joining us on this journey and continuing to contribute to the Aga Khan Foundation and its work with its sister agencies in the Aga Khan Development Network, both to respond to this pandemic, but also to the many, many other implications it has for the future. Together, we can make a real difference in the lives of people all around the world. And I look forward to working with you on that. Thank you and good evening.